Hello everyone, my name is Abdiola and I'd like to introduce you to our Project 111, which is the Fibroid initiative from Retail Banking Division of Access Bank. Now, just to tell you a little bit about it, we believe that we can help one woman, one family and one generation by our contribution to making sure that the woman's journey through fibroids is made easier. Now, it's very simple. Visit our website, our social media channels and just read about it, see how you can help get involved in our walks, in Fibroid Month initiatives, and any way you can help to make this journey a success.
I found out I had uterine fibroids when I went to serve. I have to put fibroid first before myself. If I want to eat anything, fibroid first. I want to wear anything, fibroid first. I have to check if the clothes will expose my stomach because I was already weary of people asking me questions about my tummy. They start recommending things and giving me advice on my physical life, on how to live my life, without even knowing half of what I'm going through. My way of life really changed because of fibroid. Man. I'm sorry. Anytime I talk about it, it's always so emotional because someone introduced me to a support group, Lady Oyinkan. She's a member of the W community of Access Bank. I told her about my situation, that I don't want to go under the knife and I'm looking for an alternative. She added me to a support group. I got a feedback in May that I've been selected to go through the first stage. I cannot begin to thank God enough for what the W community of Access Bank has done for someone like me. I am glad I was able to be one of the beneficiaries.
When I first discovered I had fibroid, that was in 2015, suddenly my flow was extremely high. It was always affecting me when I had to work. I had to go meet my gynae and I was like, this is what I'm experiencing. He gave me some drugs. He said, use it, it will help the flow. Then you come and do a scan, let's know what the problem is. He said it's a place where if one isn't careful, could affect the womb. At that point, I said no to operation. There's this herb you could use. There's this drugs you could use. They were saying all sorts because I refused a blood transfusion. My witness in marriage, I had to call her. I told her, look, madam, this is it. I've been scared all my life, but right now I've been told that my life is at risk here. She said that Access Bank is trying to sponsor a woman. She said, well, that's the truth. It's one woman. You could be that woman. So when I went to the center, they did a scan. They said, okay, that I'll be sent to do an MRI. I was so happy and I was so touched that I was one of those who benefited from this. I'm a whole lot better because of Access Bank. And I say thank you very much for this initiative. I didn't know life could be this sweet.
I see a light inside of you, so let it shine. It's time to spread your wings and fly. Reach for the sky. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't. There is greatness inside of you. You're the one that the world is waiting for. Every step you take, we go again. Cause we believe in you. Say one day you go make a Yes, we believe in you. Yeah. Don't you give up on yourself till the world knows who you are. Keep on shining. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't. There is greatness inside of you. You're the one that the world is waiting for. Every step you take, we go there, yeah. 'Cause we believe in you. Say one day you go make out. One day, one day, one day. One day you'll be like the sun. Say one day you go shine.
Access, more than banking.
Good afternoon, everyone. Good afternoon. I apologize that we're starting a bit late. Thank you for joining us. Thank you for joining our webinar. I want to be sure that everyone can hear me. If you can hear me, can you please just send me something in the chat box to say, oh, I can hear you, so I know that I'm not alone. Thank you, Orobosa. Thank you so much, thank you. Okay, so sorry once again that we're starting late, but we're here and we're on full speed. So good afternoon once again, everyone. Thank you for joining our Project 111 CSR Health webinar. My name is Chioma Kema Ogo, and I have the pleasure of being the moderator of today's session. So today we'll be exploring the topic, navigating fibroids, from diagnosis to treatment. July is widely celebrated as Fibroid Awareness Month. And we at Access Bank, we dedicated this month to shedding spotlight and creating awareness about fibroids. So what are fibroids? Fibroids are non-cancerous tumors that develop in the uterus of women, causing heavy bleeding, bloating, and pain. It also reduces their quality of life, confidence, and causes infertility. It is estimated that 70 to 80% of women in their lifetime will experience fibroids. And 61% of these women are not aware of the available treatment options. So with these numbers, you will agree with me that these conversations are timely and necessary. So today, whether you're newly diagnosed or you're seeking guidance on managing fibroids, or you know someone or have a loved one or a partner that's going through fibroids, this webinar is designed to provide comprehensive information that will empower you make informed decisions. We will discuss the signs, the symptoms, and available non-surgical approaches to fibroid management. Additionally, we will discuss common misconceptions around fibroid surgery. We will dispel myths and will provide factual insights into the benefits, the risks, and the recovery process. Now, before we go into the process, into the session proper, I'm sure a lot of us are wondering, what is Project 111? We listened to some ads before we started and people were talking about Project 111. So what is this Project 111 really all about? And who better to explain to us or let us in on what Project 111 is all about than the CSR head herself, Edika Musa. So please let us make welcome Edikan as she takes us through what this is all about. Edikan, welcome.
Thank you very much, Chioma, and good afternoon, everyone. Thank you for joining us on this webinar today. My name is Edikan Musa, and I head the CSR Committee for Access Bank's Retail Banking Division. So Project 111 represents a mission, which is to treat one woman with fibroids, thereby uplifting one family and impacting one generation. We believe that no woman should have to deal with fibroids alone. So Project 111 is a ray of hope and transformation addressing the physical and psychological distress caused by fibroids. Our vision includes more than just individual patient care. We hope to create a ripple effect of change that would leave a legacy for future generations. We also believe that Project 111 will have an impact not only on the hundreds of women who will benefit from direct treatment, but also on the indirect beneficiaries who will witness the transformation firsthand. So to achieve our goals, we set out 3 primary objectives that would serve as the guiding pillars for Project 111. To begin, we want to raise awareness and empower women with knowledge, encourage open dialogue, and foster a supportive community by demystifying this condition. Second, we strive to increase community advocacy by rallying support and resources to assist women suffering from fibroids. We actually want to create an environment where no woman feels alone in her battle against this condition by cultivating a culture of empathy and understanding. And finally, Project 111 aims to provide fibroid patients with discounted treatments. We want to ensure that every woman can reclaim their health, their confidence, their joy by removing the financial barriers that frequently restrict access to essential healthcare. And to achieve this goal, we have partnered with well-established hospitals across several states in the Federation. So we invite you all to join us on a journey that will not only change our lives, but also shape a brighter, healthier, and more equitable future for our women. If you or someone you know is in search of fibroid treatment, we encourage you to go to our website, which would be displayed in the chat box shortly. Look through our hospital directory. We have worked with reputable hospitals, like I said, across the nation, because we believe that together we can make a difference in the lives of women affected by fibroids. So once again, permit me to welcome you officially to this session. It promises to be very insightful. Thank you very much.
Thank you, Edikan, for shedding light on what the project is all about. Now that we all know what it's about, I trust that we would go to the website and read up some more and reach out to the team. So well done to the team that is behind Project 111, more power to your elbow. So it's now time to go into the webinar proper. Before we do so, I would like to encourage everyone to bring out their pens and their jotters and get ready to put down vital information that is going to be put forward by our speakers today. I would like you to also drop your questions and answers in the Q&A section of Zoom, not in chat, in the Q&A sections. A feedback form will also be deployed before the Q&A session. We encourage you to please fill it out, as this would help us improve our sessions and also give you access to the recording after this webinar. Also, don't forget to follow us at _project 111 official on all social media platforms. Now on to introductions. We have 2 speakers for today's webinar. Our first speaker is Dr. Abayomi Ajayi. Dr. Abayomi Ajayi is the founder of Care Nigeria Limited, an investment company focused on healthcare sector in Nigeria and West Africa. In 2003, he founded Nordica Fertility Center to provide the latest and most advanced assisted reproductive services for treatment of male and female infertility and related issues, with offices in Abuja, Asaba, and Lagos. His innovative and entrepreneurial spirit made him champion medical solutions in Nigeria's health sector, where he introduced the HIFU machine, a completely non-invasive way of treating fibroids, among other notable procedures. This led to the setting up of the Fibroid Center, a dedicated specialist center focused on the non-invasive and minimally invasive treatment of benign gynecological conditions such as uterine fibroids and adenomyosis. Dr. Abayomi Ajayi is the convener of the Abayomi Ajayi Physicians Mentoring Program, a platform aimed at providing mentorship and guidance for young medical professionals. His visionary leadership made him go into social investments, establishing brands like the Physicians Roundtable, PRT, the Endometriosis Support Group, ESGM, and the co-founder of the African Endometriosis Awareness and Support Foundation. Dr. Abayomi Ajayi is an alumnus of Stanford University's Seed Institute for Innovation in Developing Economies. Today, he will be speaking on all women need to know about fibroids, symptoms and diagnosis, available treatment options, and choosing the best treatment option, fibroid surgery, and how to prepare for it. Let us make welcome Dr. Abayomi Ajayi. Thank you, Doctor, for making the time out to be with us today.
Thank you so very much, Chioma. Thanks for the introduction. It's really my pleasure to be here today, and I hope we'll be able to exchange ideas, and at the end of the day, we'll all be better for it. So I'm just going to share my slides.
Thank you. Thank you, Dr. Ajayi. Sorry about that. I want to introduce the second speaker.
Oh, okay.
So our second speaker is Ms. Oyinkan Ogundele. Ms. Oyinkan is the founder of My Gynae Issues Foundation. She's a woman's health advocate, a 3-time fibroid survivor, and actively involved in women's health care, patients' rights, and advocacy. After a 3rd myomectomy surgery, she was able to get rid of multiple uterine fibroids in November 2018. She is passionate about helping women who suffer from reproductive health conditions. Her personal experience with fibroids fueled her passion to start My Gynae Issues Foundation. In 2020, which serves as a support system and advocacy group for fibroid sufferers and a community of women with reproductive health challenges. Ms. Ogundele will be taking us through her journey, how she discovered she had fibroids, the physical, emotional, financial, and mental effect of dealing with fibroids, and how she overcame fibroids. Thank you, Ms. Ogundele, for being with us today. Let us make welcome Ms. Oyinkan Ogundele.
Thank you so much for the warm introduction. Thank you.
So without further ado, we will go straight into the webinar, and I'll leave the floor open for our first speaker, Dr. Abayomi.
Yes, thank you. It's so heartwarming to hear, the intro of my co-speaker. I didn't know that there's such people in Nigeria who are so passionate about this kind of things, and I'm sure we'll be able to talk later on. So my topic this afternoon, let me thank you, the W initiative of Access Bank project. Can you hear me? Can you hear me?
Yes, we can. Yes, we can.
We can.
And Project 111 for providing this platform today. I'll be talking about navigating fibroids from diagnosis to treatment. Can you see my slides?
Yes, we can, Doctor.
Okay, fantastic. So as intro, fibroids, like you said during your intro too, they are benign lumps that grow in or on the uterus. And they're the most prevalent benign tumors of the female pelvis. That means they are not cancerous. And especially, Black women, 70 to 80% of women below 50 will have fibroids. Now, this ranges sizes from seedlings that we might not be able to see with the human eye, which might be responsible for why some people have this recurrence after surgery, to bulky masses that can enlarge the uterus. And these fibroids can be single or they can be in multiples. So it's not unusual to see them like the picture that we are seeing there, that actually it makes the uterus to bulge and to look like a pregnancy. And some women also can add a lot of weight. These fibroids are usually in women of childbearing age, but can show up at any age. We're seeing so many young ladies now coming up with fibroids, very big ones. And this tend to be commoner in Blacks than in whites. We still don't know why that is so. So that brings me to the causes of fibroids. What causes fibroids? We really don't have an answer yet, but we're sure that it's both hormonal and genetic. The genes responsible are still being worked on, but we're not there yet. What are the symptoms of fibroids? And this is where it becomes a little bit tricky because many women have fibroids and they don't have any symptoms at all. It just grows quietly in their tummy, and usually a lot of them are detected incidentally, either during a pelvic examination or when they're pregnant and they have to do an ultrasound. In others, they might have symptoms usually related to the menses. The menses may become very heavy, just like we heard from one of the people who gave testimonial at the beginning of the program. Sometimes it becomes prolonged. So that you see somebody that has been bleeding for 3-4 weeks, now bleeding for 1 week or even 10 days. And sometimes they bleed in between periods. So it usually affects the surface area of where they bleed from. And so there is either increased volume of bleeding or the number of days used to bleed increases. And sometimes it's just, there is, because of the mass effect, that it's pushing on organs that are near the uterus. So you can have that the woman now urinates frequently, or sometimes she has difficulty in emptying the bladder. And there could be constipation, back or leg pain. Usually there are 3 types of fibroids, depending on where they're located in the uterus. We call one intramural, which is the commonest of them, which grows in the muzzle of the uterus. And the other one is the subserous, which grows outside of the uterus. This usually they can grow very big, but usually they don't cause so much problems until probably in pregnancy. But the most troublesome one, which fortunately is the least common, is the one that occupies where the baby should be, which we call the submucosal fibroid. And this usually are very troublesome and also can lead to problem with pregnancies. Now, this is what I've been talking about. This is the submucous fibroid, which I say is the most troublesome. This is the intramural, which is in the muzzle of the uterus, and this is the subserous fibroid, which is in the outside of the uterus. You see, the way fibroids grow, they don't just stay in one place most of the time. So it's not unusual to have a fibroid in the muzzle, but also going into where the baby should be. So this is the kind of thing you are seeing here. But how do we make a diagnosis? So it starts from the pelvic examination. We could feel that fibroid, we used to say fibroids feel fibroids from pelvic examination. And then now you could do an ultrasound scan, you can do an MRI, you can do hysterosonography, and then you can do hysteroscopy. But it depends on who why the doctor wants to, what he wants to see. What we say most of the time now is that, yes, ultrasound scan is probably a common thing that everybody can probably get to do. But for some people, an MRI might be involved because especially if you've had one previous mammectomy before a second mammectomy, it's important that an MRI is done because there is something called adenomyosis, which I think Chioma mentioned during our intro, that can look so much like a fibroid, but which really is not a fibroid. And the only thing that can show the difference is when you do an MRI. Now let's go to the treatment. The doctor will consider 4 factors in telling you what you can do. Now, one thing I want to say before even upfront is that now there are many options of treating fibroids. The days are gone where all we had was just, you must have surgery. Now, but still 4 things the doctor will consider. Your age. Do you still want to get pregnant? Do you have symptoms? But most critical of it all is the location of the fibroid in your uterus. And these are the 4 things the doctor will be looking at to tell you what probably is best for you. So let's look at these options. The first one is that the doctor does not do anything. It just monitors the fibroid. So we call that watchful waiting. It's a wait and see kind of method. Because fibroids are not cancerous and they grow slowly. And they tend to shrink after menopause. So, for example, if you find a woman who is like 46, and we know that in this environment, the average age of menopause is about 44, 46. So you can wait out the fibroid and not really do anything, especially if there are no symptoms. Okay. So what I'm trying to say is that it's not every time that we see fibroid that they must be treated. So in other words, it's like you must individualize the kind of treatment for the patient. Then there are some drugs also that we can use that can reduce both bleeding and pain when you have fibroids. And so some of them I've mentioned, I've listed out. I don't like talking so much when I'm talking to patients about the names of drugs so that we always want to discourage self-medication. So surgery is probably the mainstay, and the commonest surgery up to now is mammectomy, which is mammectomy means removing the fibroid and leaving the uterus behind. And this surgery has been, has not changed much since it was described in 1840 by a gentleman called Victor Bonney, who introduced this method of treatment of fibroids. And you can do it abdominally, you can do it through the endoscope. Okay, abdominally is the usual cutting open. We know that that cutting open could be a transverse, which we call a finaster or a bikini scar, or it could be up and down, depends on the size of the fibroids and what the doctor is comfortable with. But also now we know that it could be endoscopic. And that means that it could be a pinhole surgery. And when we talk about endoscopy, we're talking about either is a laparoscopy, which is through the abdomen, which is like inserting a tube under the belly button, and you'll be able to see and you can remove fibroids through this. But there's some kind of fibroids you can imagine. You can only remove the fibroid that is either inside the muscle of the uterus or outside of the uterus through that. You cannot remove a fibroid that is where the baby should be staying. So the only way you can remove that is through what we call hysteroscopy, and which is going through the vagina into the cervix and into the cavity of the uterus. And we can do that. And that's completely scarless. But now also we have some other things like endometrial ablation, which unfortunately is not so much practiced in Nigeria, which is just, you are not really dealing with the fibroids because you are just dealing with where the bleeding is coming from, which is the endometrium. So you just burn it off. But the bad thing about that is that you can't do that for somebody who still wants to get pregnant because you are burning off the endometrium and therefore she stopped bleeding, but that means she cannot have a baby. But let me say from the get-go that the only cure for fibroids is hysterectomy, because that at that point you are removed the fibroid together with the uterus. And that is the only one that you know that there cannot be any recurrence. Anytime you're sparing the uterus by any method, there is a risk of recurrence. Now, when we talk about hysterectomy, it can be done abdominally through the cut. It can be done vaginally, and of course, it can be done through the laparoscope. Now, we call this method, the laparoscopic method, we call it minimally invasive, okay? But now, so when we look at the minimally invasive, we have the endoscopy, like I said, laparoscopy or hysteroscopy. Then you have the uterine artery embolization. But now we have the completely non-invasive. This is very interesting method of treating fibroids. Now, unless you've seen it before, it sounds almost unbelievable because it's so such that the doctor does not even touch the patient on the day of the procedure. So I will still go over that as we go on. Yeah, this is, the gentleman here is the guy who invented this ultrasound, because when we talk about HIFU, people say, oh, what kind of HIFU are we talking about? Because there are two types of HIFU. There's the MRI HIFU and the ultrasound HIFU. This gentleman was the one who invented the ultrasound HIFU, which is what we use. And this is, the ultrasound HIFU is better for fibroids than the MRI HIFU. Now, let's go back to the commonest method that we still have, which is the myomectomy. And this is a typical lineup. You see many fibroids removed. The myomectomy is such, like I said, you remove the fibroid and leave the uterus behind. And you can see in the picture that we're seeing, the fibroid is easier to remove because it's like it has a capsule. So you can see what has been removed. It's like they are in the capsules or envelopes, if you like. So these are discrete things that can be removed. That is not the same with adenomyosis because that does not have a capsule and therefore it's difficult to remove. So sometimes the kind of, when we say we have recurrence, sometimes it's because there is adenomyosis with the fibroid, and sometimes the doctor cannot do anything about that, about surgery without deforming the uterus. Maybe we come to talk about that later on as well. Now, what are the complications that can arise from fibroid surgery? The greatest thing is blood loss, because the uterus is a very vascular organ. And so the uterine artery can bleed, the blood flow through the uterine artery can be as much as 500 to 600 mils per minute. And the whole blood that we have is 6 liters. So you can imagine one can bleed out in about 10 minutes, lose the whole blood in the system through the uterine artery. So, and that is what the doctors have to grapple with during myomectomy. So there's been a lot of methods to see how we can reduce blood loss during myomectomy, and we're still going on and on to see how to do this. Then anesthetic complications are the common, also the second commonest complications after surgery. And if there's blood loss, infection also is one thing. So in those days when the only thing we had was myomectomy, it's not unusual for you to see after myomectomy that you have fever 2 days after that, after the surgery, and so on and so forth. But there's some things that we don't pay so much attention to. Those are like this long-term effects of the surgery. Deep vein thrombosis is one thing that is likely ignored in this part of the world, where you see that, when a woman has surgery, everything seems to have gone well. And this usually is reported in people who go abroad and they've had their surgery. They say it's been successful. She goes shopping. She's been discharged from hospital. And then suddenly she clutches her chest. And then the next thing, she's gone. Because sometimes this happens. A woman is obese. She's on the bed because she's had surgery for about 5 days, 1 week. And then she's discharged. And then a clot has formed in the leg veins. And then this clot becomes dislodged and goes to the major vessels in the lungs. And then she just has a pulmonary embolism. And then she can die. And those are some of the things that we don't pay so much attention to in this part of the world. So now you see that if you are going to do myomectomy, they put compression stockings. They sometimes even give some drugs to make sure that the blood does not clot, and so on and so forth. But it's something that also we are paying more attention to. Probably some hospitals are paying more attention to in Nigeria now. Then one other thing that we also don't sometimes ascribe to the surgery is what we call intrauterine adhesions. That is because no matter when you cut and you suture back, scars will form. And so you see some people after this surgery, they stop menstruating. Okay, it might take 6 months, might take 9 months, then they just stop menstruating. And that is because of the fact that the doctor had to remove, in his quest to make sure that he removes every fibroid, had to remove a fibroid that is in where the baby should be, and he sutures back. And then scars form, and then there is no place for the woman to bleed from anymore. So sometimes, you know, we say that in minimal and non-invasive surgery, that diseases that harm should be treated by things that are harmless. But sometimes you see that because of the surgery, these women who really want to have babies cannot really have babies anymore because they formed adhesions. In my clinic, we did this study, I think this was 2017, and we looked at 905 patients who had hysteroscopy who had adhesions. We looking for adhesions. And we saw that the commonest surgery that they had was myomectomy. These people who had adhesions. Adhesions are scars. These people who had scars in their uterus, which made it more difficult for them to get pregnant, even with IVF. We were people who had myomectomy, followed by people who had D&C. So the endoscopy, like I said, there are 2 types, the laparoscopy and the hysteroscopy. So these are the ones what we're showing, the minimally invasive method of treating fibroids. We also do that in the clinic, and this was 2015. We looked at the 6-year experience in our clinic, and we saw that yes, the complications from laparoscopic surgery was reduced, but it was still there. Some people needed blood transfusion, and there were still some people who had infection. And so this minimally invasive surgery or ways of treating fibroid, they are less invasive, but they still have some issues that you have to contend with. And here comes uterine artery embolization, which is also a minimally invasive method, which involves putting some particles that have been made specially for this into the uterine artery. The idea is that they cause clotting in the system, and then it makes the fibroid to be depleted of blood supply, and over time it shrinks. It shrinks and dies. Yes, this is a very good method for treating fibroids, but the problem, the call out is usually for people who still want to have children, because sometimes this can also block the ovarian artery, and therefore they might have ovarian failure. So the jury is still out whether it's safe to use this for patients who still want to conceive. And here comes HIFU. Like I said, this is the HIFU machine. On the day of treatment, actually, the patient lies on the table here, and the doctor sits on the chair here. So there is a screen even in between them. The nurse stays with the patient in the cubicle there, and then the doctor just treats the, because before now, we'll have identified where the fibroid is, and then he puts the mapping of the fibroid on the screen, and then he's doing this, using this for his treatment. And then in about 1.5 hours, if we have the time, we're going to listen to his testimonial for somebody who just had a treatment of HIFU, which lasted for just about 1 hour. The whole treatment was for about 1 hour. And she went home. So it's a day case. We go home that very day, and then we'll still talk about a little bit about this. Now, we published the first case that was done in West Africa of HIFU sometimes last year. And then now we have done 237 cases. Yes, I'm going to report about 231. I'm going to tell you about 231 later on. The question most people ask is, how does HIFU work? And what I tell people is that if you know how most things work, you see that they start from the basics. And the basic concept of HIFU is like a childish thing. It's based on the fact that you can have a convergent lens. And then if you, for example, as kids, we used to do this when kids used to play outside. I don't know whether they still do that now. DSTV and so on does not allow them, and all the games that they have, they don't allow them to play outside anymore. But in our own days, we used to have magnifying lenses, and we do magic with this, and we allow the sun, we place it at a particular distance from a piece of paper, and we find out at which point that it sets the paper on fire. And that's exactly the principle of HIFU. It converges ultrasound rays together, and at that point, it burns, just like the paper will burn. If you ever did this, if you put your hand in between the lens and the paper, it doesn't burn you. If you move the lens a little bit higher, it does not burn anymore. If you move it a little bit lower, it doesn't burn anymore. So it must be at that particular distance for you to be able to converge the rays together in order to be able to burn that piece of paper. So it's that same way that fibroids are burned during HIFU. So it's at the focus, the focal point, that the rays have the maximal effect, or where it can hit to the point of burning. So HIFU is a non-invasive technique that uses non-ionizing ultrasonic waves, ultrasound waves, to hit or ablate tissue. So it's ultrasound waves that it uses. It does not use ionizing radiation. So it's very safe. But we need to do some preparation before we can do HIFU. You know, we can't just pick a woman and say, look, go and lie down on the table. And then, so there's some things that we need to look at for. We must be sure that the patient is suitable for that method. Unfortunately, we're going to go over some of the things that might not make us be able to do HIFU for a woman. So it's not everybody that can do it. We can use HIFU for. Actually, there is no method that fits everybody. So not even open surgery. And that's why like I said earlier on, some people after their open surgery, they now stop menstruating because a wrong method has been used to treat the fibroid. Because now if you have a fibroid where the baby should be, the best way to treat it is through hysteroscopy, not through open surgery. And the other thing we do when we're preparing for HIFU is to check out for malignancy. We don't want, so we do MRI to be sure that there is nothing in the ovaries. We also do colposcopy to be sure that there is no cervical, nothing happening in the cervix. And then from the history, from all the investigations we do, we rule out the contraindications to HIFU. And then most importantly, we prepare the bowel because one of the problems that you can have from HIFU is because of the vas caca of it. that the bowel might be injured, but we've never had any. And once your preparation is good, the chances are very, very remote. So the next question is hyphen for everyone, and the answer is no. They're what we call relative contraindications, and then we're going to talk about the absolute contraindications. What we mean by relative contraindications is that whenever you see any of these things, you need to be careful, and you need to assess the patient to see whether can this patient really do IFU. And the first one is the weight of the patient. What we have done is to use 120 kg as the cutoff. Now, anybody above 120 kg, we must assess them properly to see can they really do this. The idea is that what we're particular about is the layer of fat, the subcutaneous fat, that is below the skin. What is the thickness of the fat? Okay, because I said don't forget that ray again. How we said IFU works. If we look at it again, we'll see that once the distance, you miss that distance, if the distance is missed. So, the machine is such that between where it burns and where the convergence is not really this time, is the convergence, there is a lens that does the convergence of the ultrasound rays. It's between that and where it's going to burn is between 12 to 14 cm. So if you have a woman whose subcutaneous fat is already 6 cm, that means you have 8 cm effective distance to burn. So you can imagine if the fibroid is now at the posterior part of the uterus, you might not be able to burn that. So that's why we want to always look at where is if you're above 120 kg, we now want to be able to see, can we burn this fibroid? So we do what we call a simulation to see, is this thing possible? So it's like a trial run, if you like, to see whether we can really treat this fibroid or not. The second thing is a midline vertical scar. That means a woman has had previous surgery before and is a midline, not a bikini scar. A bikini scar, even if you have had 4, we will do it. But with a midline scar, we are afraid that if the intestine stuck to the abdominal wall, because we are always afraid of the intestine, so we must always get stable. So for such a person, we also do that simulation to be sure that the intestine is not stuck to the abdominal wall. Once it's not, or once we can see that there is a way we can get to the fibroid without affecting the intestine, then we're good to go. Then the other thing is that we look at the fibroid. For example, if you can see my picture, this type 0 fibroid is a fibroid that is actually in the endometrium. You really don't want to treat this kind of fibroid with HIFU because you don't, as you will see, most of the patients who have fibroids, except when you know that they don't want to have babies anymore. That is when you can do this. So we usually would not want to treat this with HIFU because we don't want to injure the endometrium in any way. When you are treating a woman who still wants to have a baby, there's a distance that you must leave from the endometrium so that you don't in any way injure the endometrium. So those are some of the things. And then the type 7, if you look at this again, this type 7 is a subserous, that is it's outside the muzzle of the uterus, where if you burn this one, it's going to drop into the abdominal cavity, and then you could have infection. So we usually, these 2 types, we don't want to treat them with HIFU. When we have these 2 types, what we usually do, even if we have other fibroids, what we usually do is that we will treat the other fibroids with HIFU, and this type 0, we do hysteroscopy for treatment because this is actually easy meat for hysteroscopy. So we just do hysteroscopy to remove it. But patients also, another contraindication, don't forget it's relative, are patients who have done abdominal liposuction. That is becoming a very common surgery now, also in Nigeria. So when we see patients with this, because the same thing, we want to be sure that the abdominal, the anatomy of the abdomen has not been so much distorted that everything is still where they should be, and then we can do that. And for patients who are not suitable for analgesia and sedation also, we don't want to take them on because there is no anesthesia involved. What we do is analgesia. And then that is, the patient is conscious, but she does not feel pain. And then patients who cannot communicate are also a relative contraindication for HIFU, because we continue to communicate with patients during the procedure. So you are not sleeping as a sleeping off, but you don't have pain. So, but the absolute contraindications to HIFU are two. When we suspect that the fibroid has some malignant changes going through it, but the incidence of this is 0.05. So it's not a common thing, but it happens. And then, or if we think there are malignancies of cancer somewhere, either of the ovary, then we don't want to touch such a patient. And patients who cannot lie down for about 1 hour, either because they've had some orthopedic problems, then we will not be able to do HIFU for them, because you need to be able to lie down for about 1 hour, 1.5 hours, and sometimes for 2 hours. But what are the advantages of this procedure? It's a day case. So you come in and you go that very day. 2 hours max, the procedure lasts. We observe you for another 2 hours and you're good to go home. And it's completely non-invasive. So the uterus is spared, because the way HIFU works is that it only burns where the focal point. So normal uterine tissue is not affected. So you can have vaginal delivery when you get pregnant. You don't need cesarean section because you have done HIFU. You know, you don't have any need for general anesthesia, especially, you know, in this part of the world now where there's not so many doctors. This is also is an added advantage. And then you faster recovery period. 2 days after your HIFU, you can do anything. Of course, you will have started drinking by that evening. By the following day, you are returned to your normal diet. And for 48 hours, you can do almost anything. The advantages also, because it's not ionizing radiation, the procedure can be repeated. So even if you have a recurrence, you can repeat it. It does not damage your ovaries, and there is no danger to your organs at all. It is cost effective because you have decreased hospital stay. There is no blood transfusion required. There is no risk of HIV, and it is safe, very low risk of complications. But one of the selling points really and truly is the cosmetic point. I don't think it's going to be difficult for anybody to choose between these three kind of abdomen that you want to have after treating your fibroid. This is one. This is the popular case to Cairo. And this is after laparoscopy. And this is after HIFU, completely no scar. And if you look at the recovery period after the procedure, if you do ultrasound-guided HIFU, like I said, in 2 days, you're good, everything returns to normal. Hysterectomy takes you 4 to 6 weeks. Myomectomy takes you 4 to 6 weeks. Laparoscopic myomectomy or pinhole surgery takes you 2 to 3 weeks. Uterine artery embolization takes you 1 to 2 weeks. Well, is it all that there is no complication at all? There are possible complications from HIFU, and that is where the training of the doctor really comes in. As we speak, one of our doctors is in China right now, also honing his skills, because we are aware that it's a training that has made us to do over 300 patients without any real complication. So pain is not unusual for you to have pain for some time, but it's something that analgesics will take away. It's usually short-lived, mild, and usually at the treatment site, and it's because there is what we call ischemia, that is the blood supply to the fibroid has been burnt off, and so it protects for some time. Then you could have some pain in your back or buttocks. This is normal. The only one we don't want is a pain in your legs. And that's why actually we don't let patients sleep when they're doing HIFU. We want to be able to communicate with them, because once they're having pain in their legs, we want to know, because this might be that the backscatter of the heat is affecting the nerves and that's why they're having pains in their legs. And what we do is just let them relax for a few minutes or change the direction where we're treating from, and then everything is good. So it's so important for you to be able to tell us if you have pain in your legs when you're doing this procedure. And skin toxicity, that means you could have burns in the skin. Out of the 327 patients, I think it's only one that's had mild skin burn that just needed for us to dress for a few days, and that was it. Bowel injury is also a possibility. We've never had any because our patients also, we must give kudos to them. They also adhere to this treatment and bowel preparation. This is probably the most important thing. Your bowel, you must do your bowel preparation properly. And then, of course, we guide you to do that. And then there could be bladder injury, but that has never happened. Like we said, there could be damage to the endometrium, but that has never happened, which usually is like what you have when you have surgery. But this, when you choose the wrong patient, then you will have that. But we're very strict with that choice of patients. And then, like I said, the nerve injury because of bad scatter of it. Also, the moment the patient can talk to you and tell you when they have pain in their legs, you cannot have that. Now, I'm going to, because I just had a presentation in China relating our experience of the first 321 patients. So, but right now we've treated 6 more after that. So these are the first 321 patients, and you can see the age range is between 24 and 53. The mean age is about 39.3. Out of this, we had 87% or 280 of them who had only fibroids. And then we had 31 who had both fibroid and adenomyosis. Now, none of these patients knew that they had adenomyosis. They all thought they had fibroids. And even 10 of them had only adenomyosis at all. They didn't have fibroids. So if they are gone for fibroid surgery, well, the doctor might not be able to help them. Or if he did, that he might have to, he might deform the uterus in the course of trying to remove adenomyosis. And 50% of them had a history of infertility. And that's very important that we see that a lot of our women who have fibroids also have infertility. Well, I will not say that fibroid causes infertility. It is associated with infertility. So, and we can talk about that later on. Now, so, in conclusion, I'll say uterine fibroid is no longer a death sentence, and you don't even need to do surgery. You know, I know so many women, the moment they come from the doctor and they're told they have fibroids, then they stop sleeping, everything goes. But now I don't think that needs to happen anymore, because you now have a completely non-invasive method that you can use to treat fibroids. And because women are scared of surgery, that is why you see, even when they know, they tend to postpone surgery for a long time. And what happens? The fibroid becomes so big. So we think if we are able to spread this message that, look, there are other ways of treating fibroids, probably they will be able to present early, and we will stop having, you know, I've seen fibroids that are associated with renal failure because they grow so big, and now there is a backflow to the kidneys. And so we don't want to see that anymore, you know. So if we can have early intervention, some of the complications that we're having, no matter the way you now want to treat your fibroids, will reduce. Then also patients should make sure that their doctors discuss the various options possible. And they should know why they're choosing the particular option that they are choosing. Okay. I think that's the beauty, that there are options now. And women should explore these options. And also to say that non-surgical methods are as effective as surgery with less risk and complication. And so many studies have been done to show that your quality of life increases dramatically, even with non-surgical methods. The only problem we still have is managing the expectation of the patient, okay? Because many people think once they come and do HIFO, one of the non-invasive methods, that the fibroid, they're comparing to surgery where it's been removed. This fibroid has not been removed, it's been killed. So your body is going to absorb it over time. So, and that is where we have some people, they now go and do scan after, and they say, oh, the fibroid is still there. Yeah, but the first question is that, are the symptoms still there? The answer is no. Now, it's going to take some time for your body to absorb the fibroid. So all I've come to do here today, really and truly, is to take you from the old life to the new life. I hope I will have succeeded in doing that. But I'm not alone to do that. I think I'm going to introduce you to the pilots who are going to take you to the new life in the management of fibroid surgery. And these are the people who are working in fibroid clinic in Lekki. I think I still have time to play this video where we see one of the testimonials of a patient to show you how easy this procedure is.
And I'm going to read fibroid from the ahead of the program. Fibroids have really been a difference in my life. It just my quality of life a little bit. It's making things pretty uncomfortable for me that was doing. And I'm very excited to have this treatment, and I'm more excited and more glad to be 200 times today. And I'm looking forward to a better quality of life after. So after the procedure, I'm feeling good. And I'm able to go my first attempt to get rid of my fibroid. I've had surgery before, and the pain and the problem that is so intense compared to the items. Yeah, it's very difficult to go with pain and comfort. It's like it's really fun.
So, thank you so very much. I think that's where I stop. Thank you for listening.
Thank you so much, Dr. Abayomi. This was a very insightful session. I jotted down some things myself, and I have my own questions. I can see that people really enjoyed this session because the Q&A is actually heating up. There's so many questions. I know that we have a question and answer session after the second speaker has spoken, but I think that because of the number of questions that we have, and still, since you were gracious enough to keep to time, we can take about 3 questions before the second speaker comes in. So here are the 3 questions. And I'm being fair, I'm not going to ask my own question. So I'm taking this from the guests. So the first question is, there's a woman who was diagnosed with fibroids when she was pregnant in 2022. And the baby died in the womb at 40 weeks. As the baby was growing in her womb, so was the fibroid. After removal of the baby, she can still feel the fibroid moving in her. She really wants to get pregnant again and give birth. What can she do? So that's the first question. I think I'll ask all of them at once so that you can now take them. The second one is, someone is having severe vaginal discharge since she had a myomectomy, forgive me, surgery. She was told it could be due to infection and medications that were given, but the issue still persists. Should this be a normal occurrence post-surgery? What do you think could be the cause of this? And is there any hope for treatment? Now, the third one and the last one we're going to take right now is, does uterine fibroids cause abnormal vaginal bleeding? Over to you, doctor.
Thank you so much. Maybe I'll start from the simplest, the last one. Yes, it does cause abnormal vaginal bleeding. That's what we said, that your menses could become prolonged, you could bleed out of sync, it could become heavier. So yes, fibroids does that. Now the first question, fibroid and then baby died at 40 weeks. But the fibroids are still there. So I think the fibroids should be attended to first and foremost. And then, because 2021 to now is already 2 years. You know, something about fertility is that it decreases with age. So if you got pregnant in 2021, your chances of your ability to get pregnant again in 2023 is not as even good as 2021. So I think there's been a lapse here. And I think the first thing is that let's look at the fibroids and see what can be done about them before even trying to get pregnant again. That would be my take on that. Now, vaginal discharge after myomectomy. What I would say is that please see a doctor or see your doctor. It might be worthwhile doing a hysteroscopy because you could have a submucous fibroid which was not removed. And sometimes as a foreign body, there could be some of the stitches that were used. Depends on where this, because you know in Nigeria, everybody is a gynecologist. But that's not true. So we hear a lot of things. And so please, I think the first thing is go to a doctor that you know is a gynecologist to start with. Possibly somebody who can do endoscopy. And so they can look into your uterus and see whether there is anything there that needs to be attended to. That would be my, I think, yeah, I've done the three.
Thank you, Doctor. There's still more questions, but I think we'll go into the next session. We'll go with the next speaker. But before we get into that, I would like to encourage everyone. Yes, we have a lot of questions, but keep your questions coming. Like I had said when we started, this is a very interesting and insightful session. There's no question that is stupid. There's no question that is dirty. There's no question that we cannot take. The professionals are here, so keep your questions coming. Also, I would like to remind us that we'll be sending out a feedback form. So we encourage you to fill it out. This would help us, to really help us to bring you better service, better webinars in future. And it will also, your filling out this form will give you access to the recording of this session. So please fill out the form. And thirdly, follow us at project_111_official on all social media platforms, on Instagram and YouTube. Now, I'm sure that we're ready to hear from our second speaker, who's coming to speak to us from an experiential point of view. So let us welcome once again, Ms. Oyinkan Ogundere. Ms. Oyinkan, the floor is yours.
Good afternoon, everyone, and thank you so much for this opportunity. I'm really grateful to be here. I'm very excited to be part of this great initiative. Thank you to Dr. Ajayi for such an insightful presentation. Honestly, I'm listening to you speak. I wish that IFO was available when I first got diagnosed with fibroids about in 2001 actually. I don't know how many years that is now, maybe about over 20 years ago. I wish that, HIFU was available then, because I wouldn't have had to go through 3, myomectomies. In fact, I had 4 major surgeries. 3 of them were myomectomies, just to try and get rid of fibroids. So thank you so much, for the session. Can everyone hear me?
Sure.
Awesome. Okay. Yes. All right. So I'm speaking here today just as a patient. I mean, Dr. Ajayi has covered almost everything, to be honest. But I will speak from a patient's perspective. And so I'll tell you about how I first got diagnosed with fibroids, or how I discovered that I had fibroids. This was in 2001, like I said. It was during a routine scan, because I had an annual health check. That's something that I usually encourage women and even men to have an annual health check, like an annual health screening. It just helps to know, like do an MOT of your body to know what's going on in the body. And, if there's anything, that is wrong, you may be able to, or you should be able to, nip it in the bud on time. So I had, an ultrasound scan. It was a routine scan. And the doctor mentioned, the sonographer mentioned that, oh, you have some fibroids. They're not many, they're not, big, they're just tiny, about 2 or 3. I think we should just, you should speak to your doctor. And then when I spoke to the gynecologist subsequently, my gyne doctor said, oh, they're fine. Let's just adopt the watch and wait strategy. Now the watch and wait strategy is something that Dr. Ajayi mentioned earlier on. Let's just watch and see if it grows and all. But I didn't pay attention, obviously, because I didn't really know what I know now. So I just thought, watch and wait, what's that? I just carried on my business. It didn't affect me. There was no symptoms. I didn't even know that I had them until, the scan. So I just went about my normal life for the next, maybe 4 or 5 years, until sometime in 2005, when I started feeling, heaviness in the lower region of my stomach. I was having, frequent urination, excessive bleeding at some point. I then started having bleeding excessively. I started using 1 pack of pads to using 4, 5, 6, packs of pads. I couldn't understand it. Sanitary towels, I mean. My sanitary towels I then had to start doing this thing that looked like a sandwich to be able to, sustain myself. And that only lasted me for about 15 minutes. If I didn't change within 15 minutes of putting on those, sanitary towels, I got soiled. It was really bad. It was very emotional. I began to have, anemia, severe anemia, because I just couldn't stop bleeding. The bleeding was just continuous. So that was in 2005. Then I went to speak to, my gynecologist again, and the doctor said, oh, you didn't come back after, after our last discussion. We should have been checking these things. So another thing that, people need to learn. So when the doctor tells you adopt a watch and wait strategy, I think, you need to continue to check it, maybe every 6 months, every year, just have a look to be sure that, it hasn't grown beyond, the way it should be. And if you heard Dr. Ajayi speak earlier on, actually, he said, when you, try and deal with it early, quickly, then you don't get it to the point where it's causing other health, challenges. But how was I to know? I didn't know. Awareness that we have now wasn't really available back then. So I was just, doing the things that I felt, I had to do. So subsequently, then the doctor said that, oh, you have to have a myomectomy. I said, what's that? He told me that it's a procedure to remove the fibroids. I chickened out because obviously I didn't want to have surgery, because obviously the first, emotion that I felt was, I was afraid, surgery, I'd heard of people who died during surgery, so I didn't want to have surgery. So I left. But 2 years after, in 2007, I couldn't help myself. I couldn't stop, bleeding. The bleeding just was continuous. So I went back to the doctor, and the doctor said, well, madam, you need to have this, procedure done. So after so much, running around, I finally, succumbed to having surgery. So I had that surgery. That was my first surgery in 2007. And it seemed to be okay for a while, until about 2010. So I got married, and then I took a medication. A cousin of mine came and said, oh, have you heard of this medication that people are taking. When you take it, you have multiple births, you can have quintuplets. In fact, at that time, a woman had just had quintuplets in the UK, and it was such a controversy anyway. I'm not going to talk about that now, but that particular medication, was recommended. And because we're in Nigeria, some medications are supposed to be, prescribed. But this was an over-the-counter medication. I don't want to mention the names because I don't want people going to buy it, but it's something to help to stimulate or induce ovulation. So I bought this medication without checking with my gynae doctor. I took it, of course, when I read the contraindications, one of the things that it said was that do not take without the supervision of your doctor, of your gynae doctor, especially if you had, fibroids. But to be honest, what are the odds that would be me that was, talking to? I didn't really bother. I just took it. And within a month of taking that medication, I started feeling bloated. I started feeling, my stomach started growing. Then I felt maybe, I was pregnant, but I kept on doing checks and it was not pregnancy. Subsequently, the doctor diagnosed me with uterine fibroids. There were multiple. There were so many of them. Within 2 or 3 months of taking the medication, my stomach was, big. And so the dilemma started again. I started bleeding heavily. I, had anemia. I couldn't focus. I was, losing blood constantly. I was constantly tired. So when, at a point, I didn't know what else to do. I had to then, go and subject myself to another, session of myomectomy. Now, I forgot to mention that the doctor that was treating me was actually administering a drug that Dr. Ajayi had mentioned earlier on, called Zoladex. The Zoladex is in the family of the GnRH analogs, and what it's meant to do is to shrink tumors. So the doctor wanted to shrink the tumor so that they can minimize blood loss. But that process, that procedure, unfortunately, was not working for me. And like Dr. Ajayi said, not all procedures work for everybody. So anyway, I was subjected to this medication the first time. The second time I had to take the injection again. I took it. And once I took the injection, I took one injection every month for 3 months. I realized that, the fibroids actually shrunk. And it looked like I didn't need surgery. But the doctor told me that, once you stop the medication, the fibroids go back, which was what happened, I think that first time. So second time around, I took the medication and then I went in for surgery. Now, after that second surgery, I was also told that I had a cyst in my right kidney that needed to be taken out. So 6 weeks after having a myomectomy, I needed to have, a right partial nephrectomy to get rid of a cyst in my right kidney. Now, in the process of doing that, the doctor had to do some, scans and checks. Whilst having the ultrasound scan, it was discovered again that, the fibroids had come back. At that point, I was like, oh my God, what's going on? If you, in Nigerian parlance, we call it home trouble. I said, this must be home trouble. Somebody must be after me. What did I do? Who did I offend? And at that point, I realized that I had to take my own health into my hands. And that was when I began to advocate for myself. Then I began to research into, the causes of fibroids. Why was I getting them? Why was I regrowing them? The doctor told me that, I had this aggressive type because they were just growing. They just kept on growing. They didn't stop. But subsequently, of course, from research, I realized that that medication, that Zoladex that was being administered on me, didn't actually work correctly, because I think when you after taking the injection, there would be some fibroids that would shrink so much so that they're so tiny, they're almost insignificant. And the doctor, during surgery may not see them, or they're almost negligible, they're not seen. But right after you stop taking the medication, they grow back. I'm sure that Dr. Ajayi can corroborate that. But anyway, after that second surgery and the third surgery that I had to remove the cyst from my kidney, I realized that I needed a fourth major surgery, which was my third myomectomy. And like I said, at that point, I started advocating for myself. So I started consulting with all sorts of doctors, so many professional doctors. But I then realized that I needed to have a connection with my doctor. So that's one thing that I would advise women to do. Not every doctor is your doctor. Make sure that you connect with your doctor. And that sort of helped me subsequently. So after, the fourth surgery, the doctor was able to get rid of all the fibroids. The Zoladex injection was not administered this time. So I had a full open myomectomy, like Doctor mentioned earlier, from up above the navel down. to the pelvic region. So finally, the fibroids were taken out. And I've been free from fibroids, 6 years and counting now. It's been such a beautiful, wonderful experience. The trauma that I went through, I can't even begin to tell you how much, pain I went through. I was bleeding, all the symptoms that Dr. Ajayi mentioned I had. I was bleeding between periods. I had frequent urination. I had, urinary incontinence, just leaking urine all the time. I couldn't wear white. I mean, today you can see me, I'm wearing a white jacket, a white blazer, because now I have overcome the fear of wearing white attires. I mean, all I had in my wardrobe was just black outfits. I never wore white because my period would just start. And within 10 minutes of it starting, I'm all soiled. So I was always wearing dark colored clothes, dark clothes. Nothing, I couldn't wear anything with color or white. So now I can wear white. I mean, at that time, like I said, I had fear of wearing white. I didn't like wearing red as well because it just reminded me of, seeing a period all the time. So I stayed off red, stayed off white. And then the comments that you get from people are asking you, oh, are you pregnant? Oh, congratulations. They feel like they're offering congratulations and they're being, and they're being kind. But sometimes, it just keeps you in this very low mode because you know that you're not pregnant and you're dealing with something that is definitely not a baby and that is sucking blood out of you and it's almost taking life out of you, Fibroids for me at the time felt like a death sentence. Even though, now we know that it's not a death sentence, and I'm preaching that it's not a death sentence. If I'm here and I'm speaking to you today, it is because I was able to overcome fibroids. I'm grateful for, the opportunity that, HIFU presents and, all the other, medical interventions that are available. I know that, like doctor said, not everybody will be able to have the HIFU procedure. I'm sure that if it was now, after 3 surgeries, I'm not sure that I'll be able to have that HIFU procedure. But I'm grateful that this opportunity is being offered to other women. And I'm thankful that the information is out there. And that's the reason that, the awareness that we are creating is so important. And I want to also encourage other women to join the campaign. And we need to begin to advocate for ourselves. No doctor knows your body as much as you know your body. I mean, even if they know the theory, they're not feeling the things that you feel. So as soon as you begin to, to experience any symptoms that doesn't feel normal, I think that it's time to, get checked, do an annual MOT, do not self-medicate. There's so many things that I can talk about, but I'll pause for a bit just so that, the anchor, can ask any questions that she wants to ask. I hope everyone could hear me. I hope I wasn't just speaking. Okay, great. Awesome. Awesome. Thank you so much for the opportunity to share.
Thank you, Ms. Oyikon. Thank you for telling us or sharing your story with us. This is very brave of you from our society and how we like to hide, health issues and stuff. This is encouraging, and I'm sure a lot of women that are going through this are also encouraged. So there were some things that you mentioned that I took down. One of them was every woman should go out there and do their annual checks. They should do their annual checks. That was how you discovered, that you had fibroids in the first place. So that's very important for women and men to do their annual checks, even if there's nothing wrong with you, just be sure that you're fine. And another thing that you said was that we should do our research. So do your own research. Of course, you go to the doctors will tell you, but it's good for you to also educate yourself on things that are happening now. And thirdly, what you said was not every doctor is your doctor. And that's very true. Not every doctor is your doctor. And the doctor does not know your body as well as you know your body. So if you feel that there's something wrong with your body, then you should go and see the doctor and tell the doctor, this is what I'm experiencing. So thank you so much for that.
The final thing that I also said was that people should not self-medicate. I actually didn't expatiate on that. So when I took the drug that I talked about that people were taking to help with their ovulation, I believe that drug was what fueled the regrowth of the fibroids that third time. And that was what made me have to do another myomectomy. So do not self-medicate. Even if people are telling you this drug is, what I took to help me with this, find out, speak to your doctor before you take any medication. It's so important that we do not self-medicate. And a lot of us, we take paracetamol. I have a headache, I go to the chemist, I buy paracetamol, I buy something for fever. But it's important that you speak to a doctor before you take any medication. So key. Thank you.
Thank you. That's very important. We shouldn't self-medicate as well. We can make it worse. We can make the situation worse. So I'll go into our questions. Our questions are burning up. So I think I'll take it 3 at a time and allow for the questions to be answered before I go to the next set of questions. So the first question that I have here is, after doing a fibroid surgery, is it possible for it to regrow? Or is there anything that can be done to prevent it from resurfacing? The second question I have here is, can soursop fruit help in the management of fibroids? And the third question I have here is, which is the most delicate type of fibroid? And how many times can one do fibroid surgery? All these questions, I believe, are directed at Doctor. So, Doctor, you have the floor.
Yes, thank you. Thank you. I think Lady Ogundele has done a lot of work for me, so I'm not going to go into that area again. She said so many things I would have wanted to say. I think one of the things that we doctors are beginning to learn, that we don't own patients' bodies. And therefore, patients need to know everything. Please do not take any drug for any doctor who does not tell you the name of the drug you're taking. Simple. Now, can fibroids regrow? Yes, I said that during the presentation, that once you're leaving the uterus behind, then the fibroids can regrow. And every method that leaves the uterus behind has a recurrence rate, though the recurrence rates are different for each of the methods. The good thing is that the HIFU has one of the lowest recurrence rates, but every method there can be recurrence or regrowth. Because like what she also said when she was taking Zoladex, that sometimes when the doctor is doing surgery, he can't, because what the doctors rely on when they're doing surgery is sight and feel. So sometimes you cannot see the smallest nodules, and then they get bigger over time. And like I said also, sometimes you have adenomyosis of the fibroid. There is nothing the doctor can do about that. Soursop and fibroid, I would say I don't know, because I'm not, that's not my specialty. So I don't know about whether soursop can help. I hear they use it for prostate. I hear, some of these things is, I don't know. That's what I think it's just safe for me to say, I don't know. Which is the most delicate type of fibroid? Yes, it's the submucous, the one that stays where the baby should be. It's the most troublesome because it leads to a lot of bleeding. It can lead to people losing pregnancies. And so it's the most delicate type of fibroid. Well, fortunately, it's the least common of all the types of the fibroids. Then how many times can you do fibroid surgery? I prayed, because anytime you do surgery, there is scar. There's this risk of scarring, because so the more you do it, the more that you are going to have scars. Usually scars are the worst things for your fertility. So for people, as much as possible, we pray that you will have only one surgery. Okay. And the good thing about HIFU is that unlike it does not produce scarring. So you can do it 2 times. God forbid that you do it 3 times. But yeah, so there is no scarring involved at all, because there is no cutting. We just burn the fibroid off. So, but there is no thing. For example, we had Ms. Ogundele said she's done 3 mammectomies. Yeah, so there is no prescribed number that you are allowed to do that you cannot do. But everybody hopes that they don't do more than. So I'm sure surgery is not something anybody looks forward to. I think I'm done with your 3.
Yes, thank you, Dr. Barami. So I'll move on to the next set of questions. Sorry, they're coming in fast. I'm trying to go to where I stopped. So, can a symptom of fibroids be a woman doing her menses twice a month in the space of 18 days?
Yes.
That's the first question. Oh, yes, it is. Okay.
It can be. It can be.
Okay. A doctor in attendance wants to know how one can enroll into the mentorship program for a Bayomi Ajayi Fibroid Initiative. And someone wants to know what is adenomyosis. So I think we'll take these ones for now.
Okay. Yes, the mentorship program is not for fibroids. Actually, it's for young doctors. And it's born out of the scenario now that we have a lot of young doctors just going abroad. Majority of them don't even know why they're going. It's just because people are going. And they're leaving a lot of opportunities in Nigeria to go to. I don't know why somebody should think light, constant power is what should make you go to another man's land. Anyway, that's what. So we set this up in order to handhold these young doctors in making career choices, you know. So I have a couple of people with me. They are not necessarily doctors. Some of them are accountants, some of them are lawyers who have done well in life. Some of them are engineers. Some of them are VCs of universities, you know. And so we now pair them with these young men to make them see what opportunities are bound in life, even if you are going abroad. So that's what this is all about. So it's not for fibroids. Adenomyosis, it's a condition like, well, where there is bleeding, it's like, you know, it's like there's bleeding into the muscle of the uterus. Now, I am trying to not to use the technical terms of endometriosis. You know, we talk about endometriosis where the lining of the uterus is in another place apart from where it's supposed to be. What happens in adenomyosis is that lining of the uterus is in the muscle of the uterus. So it appears so much like fibroids, but it's not fibroids. It's when the doctor gets there, if he does not make the diagnosis before going for surgery, it's when he gets there that he sees that unlike fibroid that has a capsule, which you can twist around and remove, adenomyosis, because it's bleeding, you cannot remove it. So you probably have to be cutting into the uterus, and most of the time you deform the uterus. Don't forget that majority of these women who also have fibroids want to have babies. So if you have deformed their uterus and then they cannot now have babies because of the surgery that you have done, then it's a double jeopardy. So that's what adenomyosis. I hope I've been able to say that and explain that without confusing the person who asked the question.
Thank you, Doctor.
The test is, Chioma, do you understand what I've said? So if you do, then it's likely. Okay.
Yes, I do. I do.
Okay.
Thank you, Doctor. So we have, I think, 2 questions here for Ms. Oyinkan. So the first question is there a support group for patients and family members for people that are going through this? And the second was, how did you cope with expenses that you incurred? How did you cope with the expenses? Is there somewhere was there somewhere you went to that helped defray some of your expenses that you could also recommend?
Thank you so much for those questions. Amazing. I mean, very, very important questions to ask. So the expenses, so I'll talk about the support group first. So there was no support group when I, experienced fibroids, and, it was a lonely journey for me. I felt like I was all alone. I suffered fibroids for 12 years before I finally, got rid of them. So I would say that it's the reason that I started, this my gynae Foundation. I would say that that's a support group that is available. There's so many women, so many ladies, on our platform who, share their experiences. Sometimes, just speaking as women, our voices are so powerful. There's so much that we can do. Somebody was just telling me on the platform that, an institution was able to make a change based on, our voices, the collectivity of our voices. So I will say that, My Gynae is available. We are available on Instagram as My Gynae Issues. We have a support group where, you can ask any questions. It's so important that you can actually, speak to somebody who's gone through the experience. And it's not just myself that has had, a myomectomy or 3 myomectomies. We have other people on the platform. Victory is a member of our community, and she had, the HIFU treatment, courtesy of Access Bank. And so I'm really grateful for the opportunity to be able to, to render, that support, that community. We hold women's hands. It's so important to have somebody, to talk to somebody who understands what you're going through. It's not just, talking to a doctor. Thank God for Dr. Ajayi and the likes of all the doctors. They're doing an amazing job. But sometimes just having somebody who's gone through the experience, is a game changer. I remember the first time I spoke at an Access Bank event as well in 2019. It was a doctor, my doctor had organized this annual seminar. And I remember connecting with several women because they heard my story that I've had 4 major surgeries, 3 of which were to get rid of fibroids. So it's so important to find a community, find a support group, and ask the right questions. Ask the right questions before you go and speak to a doctor. It's so important to have that because when you're armed with information, you can ask the right questions and you can advocate for yourself. And no doctor can gaslight your symptoms. So yeah, My Gynae Issues Foundation, we're available on Instagram, we have a website, and we are on Facebook as well. Now, expenses, it was such an expensive venture. Honestly, I can tell you that I did not have any savings whatsoever when I had fibroids, because every month, number one, everyone had something to advise. I heard that question that, it's our soft work, and I just kept quiet. But there's so many things that people recommend when you have fibroids. They believe that, it's, when you drink alcohol, you can break it down. They believe that, if you take something that is so strong, it will disintegrate. But I tell you that fibroids are muscular in nature. And if you remember, there's a particular type of meat that we can chew. In Yoruba, we say it's ishan, it's like muscular. You can chew and chew and chew. That's how fibroids are. You can chew it for the next 3 days. If you don't swallow it, it doesn't go away. So, just thinking that you can drink this or drink that is not good, because I can tell you that I believe that the cyst in my kidney that I had at the time was actually as a result of all the things that I drank. There were so many concoctions, so many things. In fact, I spoke to one lady the other day. Somebody had told her to drink cactus juice. Do you know what the cactus plant? Some people say it's poisonous. She blended it, squeezed the juice and ingested it. And then she had a mouth ulcer for weeks. I don't know how. I said to her, are you sure it wasn't aloe vera that the person told you? She said, no, it was cactus. And I was like, really? Some people just prescribe whatever. They can tell you anything. So I was spending money on herbs, on all sorts of things. Too many things on Instagram, too many things on. But honestly, the best way to get rid of fibroids is to ensure that you find the solution that works for you. Trial and error and all of those things, don't work. But for me, I'm grateful for the organization that I work for. If you have an organization that supports you, I think it's important to applaud them. I've worked in the same place for about 12 years, and the support that they offered was so helpful. There were so many times that I had to go away for 3 months, at a stretch, because I needed to get rid of fibroids. So now we've set up this support group where we try to help some women who, also cannot afford, their care. And I know that that's also something that Access Bank is doing, trying to make sure that, the HIFU process, I'm sure it's an expensive procedure right now. How do we make sure that it is readily available to a lot of women out there? How do we make sure that, we can subsidize, the cost? And maybe, the other thing to do is, if you can sign up with, health insurance is so important these days. I remember that my last surgery was actually my HMO, Health Maintenance Organization, that paid for the surgery. So, trying to sign up with all of these, kind of organizations, I think can help. But, you can speak to us at My Gynae, and if we can render any support, we'll be able to advise you. But again, I'd like to say thank you so much to Access Bank for your initiative. It's so amazing. Thank you.
Thank you, Ms. Oyeko. So we've run out of time, and I can see them telling me that the time is almost up, but I will use my veto power to ask this next set of questions before we end it. So we have over 100 questions. I wish we could take every one of them, but we cannot take them at this time. So these are the last set of questions I'm going to ask. They are 1, 2, 3, 4, 5 questions, and they're all for Dr. Ajayi. So I'll start. Doctor, I hope you're ready for us. So the first one is, for someone that has a massive fibroid, what is the best method, best minimally invasive method the person can do? The person is still young and fibroids is affecting fertility. Can a woman with fibroids give birth normally without a cesarean section? That's question 2. The question 3 is, what is the best option to treat fibroids that is available for a 54-year-old with a history of high blood pressure? And then, how long will HIFU treatment, how long after the treatment can one conceive? And finally, can fibroid cause anemia? So over to you, doctor.
All right, thank you. Yep. Massive fibroid, what kind of minimally invasive surgery? I think, I'm sorry to disappoint, but you have to see a doctor so that, because the things have to be, everything has to be taken into cognizance. But size, if you're asking whether size is a contraindication to HIFU, no, size is not a contraindication to HIFU. So we've done 34 weeks. That are 34 weeks means like 8 months pregnancy. So we've done that. But so please, it's not a theory question, it's you. So you have to, the doctor has to see you and make recommendation. If you have fibroids, do you need to do cesarean section? These are questions that, they are practical questions that you need. The answer comes, they are individualized, because where is the location of the fibroid? Anybody, if you have fibroid and you get pregnant, you are at risk of having what we call postpartum hemorrhage, that is to bleed after you've given birth. So, but the doctor needs to know where exactly this fibroid is, and therefore will be able to advise you on whether you need cesarean section or you don't need. But maybe the easiest question is about the 54-year-old with high blood pressure. What we need to rule out is that there's nothing, because for a 54-year-old, she's still menstruating. That's why she wants to probably do something about it. We just need to be sure that there's nothing else apart from the fibroid. HIFU is a wonderful method for her. But like I said, always say, the decision has to be made in the consulting room. The doctor has to see the patient, see that there are no contraindications to whatever we're talking about, apart from what she has said. How long after HIFU can you conceive? 3 months after. You can, that's what we do. 3 months after HIFU, you can conceive. Does fibroid cause anemia? Oh, yes. Ms. Ogundele also told us in our own experience. Yes, it does cause anemia. So I think I'm through with the 5 questions.
Thank you, doctor, and thank you for helping to keep to time. Even people are chatting me on WhatsApp. I wish I could take all these questions. I'm sorry I can't, but we will look at these questions and we will answer them we'll answer them and put it up on the website for people to see. So thank you. So I think I will hand this over now to our group head for consumer banking, Njideka. Njide, over to you.
Yeah, good evening, everyone. And thank you so much, Dr. Bayomi. And thank you, Chioma. You've done a very good job, wonderful job indeed. And Lady Oyiko, thank you so much. I've learned so much. You won't believe what I have learned and what I took for granted a long time ago. And like you said, is something that's been plaguing women. And I think you've given an insight into what to do. I like the fact that there's a support group and will encourage women to join the support group. Dr. Jai, thank you so much. Thank you very, very much. On behalf of our Project 111, a project that is very dear to the bank, a project supported by the retail group of the bank, we say thank you. Very well done. Thank you to all the people that joined. We had over 300 participants. It was amazing, really. And we have questions unanswered yet. And like Chioma said, we're going to post those questions. We're going to take them on, get Dr. Bayomi and Lady Oyiko to respond to those questions, and we'll post it so people can have ready answers. Thank you very much. And we encourage all participants to follow us on our social media handle and ask all the necessary questions and support our Project 111. We can't do it together. We can't do it alone. We have the support of the doctors. We have the support of the groups that support women. And we're very happy that the turnout was great. Thank you so very much again, Dr. Bayomi. Thank you, Lady Oyiko. And thank you for our over 300 and over participants that joined us. Thank you. And you guys should have a very lovely weekend. Thank you very much. Thank you.
Thank you so much. Thank you.
Thank you.
So I think I can officially bring the webinar to a close. Thank you once again to everybody. Thank you, Doctor. Thank you, Ms. Oyiko. Thank you, Access Bank. Thank you to the team that put this together. And I'm sure we'll have more of this and we'll have more success stories. Goodbye, everyone, and enjoy the rest of your day.
Thank you.
Hello everyone, my name is Abdiola and I'd like to introduce you to our Project 111, which is the Fibroid initiative from Retail Banking Division of Access Bank. Now, just to tell you a little bit about it, we believe that we can help one woman, one family and one generation by our contribution to making sure that the woman's journey through fibroids is made easier. Now, it's very simple. Visit our website, our social media channels and just read about it, see how you can help get involved in our walks, in Fibroid Month initiatives, and any way you can help to make this journey a success.
I found out I had uterine fibroids when I went to serve. I have to put fibroid first before myself. If I want to eat anything, fibroid first. I want to wear anything, fibroid first. I have to check if the clothes will expose my stomach because I was already weary of people asking me questions about my tummy. They start recommending things and giving me advice on my physical life, on how to live my life without even knowing half of what I'm going through. My way of life really changed because of fibroid. Like, oh man. I'm sorry. Anytime I talk about it, it's always so emotional because someone introduced me to a support group, Lady Oyiko. She's a member of the W community of Access Bank. I told her about my situation, that I don't want to go under the knife and I'm looking for an alternative. She added me to a support group. I got a feedback in May that I have been selected to go through the first stage. I cannot begin to thank God enough for what the W community of Access Bank has done for someone like me. I am glad I was able to be one of the beneficiaries.
When I first discovered I had fibroids, that was in 2015, suddenly my flow was extremely high. It was always affecting me when I had to work. I had to go meet my Ghana and I'm like, this is what I'm experiencing. He gave me some drugs. He said, use it, it will help the flow. Then you come and do a scan, let's know what the problem is. He said it's a place where if one isn't careful, could affect the womb. At that point, I said no to operation. There's this herb she could use. There's this drugs she could use. They were saying all sorts because I refused a blood transfusion. My weakness in marriage, I had to call her. I told her, look, madam, this is it. I've been scared all my life, but right now I've been told that my life is at risk here. She said that Access Bank is trying to sponsor a woman. She said, well, that's the truth. It's one woman. You could be that woman. So when I went to the center, they did a scan. They said, okay, that I'll be sent to do an MRI. I was so happy and I was so touched that I was one of those who benefited from this. I'm a whole lot better because of Access Bank. And I say thank you very much for this initiative. I didn't know life could be this sweet.
I see a light inside of you, so let it shine. It's time to spread your wings and fly. Reach for the sky. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't. There is greatness inside of you. You're the one that the world is waiting for. Every step you take, we go there, 'cause we believe in you. Say one day you go make a one day, one day, one day. Yes, we believe in you. Don't you give up on yourself till the world knows who you are. Keep on shining. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't. Inside of you, you're the one that the world is waiting for. Every step you take, we go there, 'cause we believe in you. Say one day you go make a one day, one day, one day. One day you go make a one day, one day, one day. One day you'll be like the sun. So one day you go shine.
Access, more than banking.
Hello everyone, my name is